There's just 1 week until spring break is here in BC, but health officials say getting vaccinated now against measles could still offer last-minute protection if you're traveling. So far, the province has 4 reported cases. But with outbreaks occurring in Ontario and vaccines running out in parts of Texas as it grapples with its own outbreak, we thought it would be a good idea to bring in a specialist to explain why getting vaccinated is so important before you travel. Jennifer McNichol is a PhD student in mathematics and an infectious disease modeler and the lead author of a recent SFU measles study. Jennifer, thanks for being here. First of all, just one of the 4 cases reported so far in BC is not travel related. What do you think of the response so far to the numbers, at least in this province?
So far, 4 cases, I wouldn't say is worrying to the general public, as long as you are vaccinated. We know that vaccination is 97% effective at protecting you against contracting measles. And most of the time, all of the time, when an outbreak starts, it's always because of a travel-related case. You know, the virus has to come from somewhere. So getting vaccinated prior to travel, if you're not already, is extremely important, especially with the upcoming spring breaks.
Now, what did your recent study show you about outbreaks and why they're happening?
So we modeled measles outbreaks in small community settings, and we looked at how long they can last for and how big they could get. So in a population size of 1,000, so imagine a small community, say, circulating around a school. So the recommendation is that people, 95% of people are vaccinated, but if the coverage in your community is a lot lower than that, say, 70% or below is really dire, we could see outbreaks for as long as 2 months, affecting hundreds of people, even in a small, close-knit community.
And Jennifer, what advice do you have for anyone who hasn't gotten the vaccine yet and may be traveling for spring break or just concerned about their health?
Yeah, so measles is very contagious, and the vaccine is very safe and very effective at stopping you from getting measles. So I would recommend that everybody gets vaccinated with 2 doses of the MMR vaccine or a measles-containing vaccine. It's MMR in Canada. And if you're not already vaccinated or you don't know your immunity status, you can get another dose. And that is what the public health guidelines are currently.
All right. Jennifer McNichol, we appreciate your time and your expertise. Thanks for joining us.
Thank you.